Snoring is often talked about, and it seems to become an issue, like tradition. It's something what my grandparents did, my parents do, and I do too. It's often seen as a sign of aging. Every day, I ask my patients about their sleep, and I notice that many people who suffer from bad sleep answer my questions that they also snore. Some of them tell me that their partners snore, which bothers them a lot. Sometimes snoring is so bad that they have to sleep in a different room. Sound of snoring can be unique, but in any case, I consider it a message from the body, sort of like cry for help. Snoring occurs when flow of air through the mouth and the nose is partially blocked during the sleep, causing sound of air passing through the obstacles. If you snore, it could indicate that you have a serious condition called sleep apnea. It's important to consult with a sleep doctor and undergo sleep studies to determine if you have or not this condition. And at the same time, it's very delicate topic if you sleep next to the snoring partner. I would like to outline 5 main reasons for snoring and how to approach them. First reason, difficulties breathing through the nose. This blockage can be caused by several factors, including obstructed nasal airway. If you have cold, allergy, or deviated septum, it can make it difficult to breathe through the nose. I talk about this topic on my channel with ENT doctors, and they suggest using medication to continue breathing through the nose during allergy season. If you have underlying issues such as a polyp, sinus infection, or deviated septum, ENT doctor can help you to address them as well. If your nose is still blocked, I suggest doing simple exercise to unblock it. Take 3 natural breaths through the mouth and the nose, whatever, and then hold your breath until you feel hunger for air. Then, when you cannot hold it anymore, take a breath through your nose. By that time, nose should be unblocked. If not, you have to repeat this exercise 3 times. If only one nostril is blocked, close the open nostril and do the same exercise with the blocked nostril. Second reason, poor muscle tone in the throat and the tongue can cause snoring when muscles in the back of the throat and the tongue are so relaxed and that causing them to fall back partially and block the airway. As I mentioned earlier, it's important to prepare for good night's sleep during the day. I notice that people who suffer from seasonal allergies, asthma, or who breathe through the mouth, or both, how they call it, mouth and the nose, have a very weak muscle tone in the throat and the tongue. Then tongue stay in a low position to keep mouth airway open. It can fall back in the airway when person relaxes during the sleep. Low tongue position can be visible from outside as a double chin, like extra skin underneath the jaw. That's the low tongue position. If air passes through the narrow airway, which is a tube with the uvula hanging and throat tissue hanging and tongue partially blocking it, it produces turbulence and causing airway to collapse further. A result of that passage of air, we hear snoring. There are several products that able to reduce obstacles and narrowing of the airway, such as a mute to open the nose, and different nose cones you can use as well. Excito SA to stimulate tongue muscles, and bongo, like a little nose mini CPAP machine, but only in the nose. I interview the representatives from those companies on my channel as well. Third reason is extra weight. Obesity is another factor that can contribute to snoring, as people who are overweight have excess of tissue in the throat, which narrows the airway and makes snoring louder. During my studies in medical school, I was amazed that tongue has so many muscles, but at the same time, it also has a space which can be occupied by fat. And same goes for the throat. As a person gains weight, tongue can get bigger and airway can get smaller, increasing turbulence in the air and makes snoring worse. Fourth, sleep position can have significant impact on snoring. Sleeping on your back can cause tongue and soft tissue to collapse in the back of the throat, obstructing airflow and leading to snoring. However, sleeping on your side or using a wedge, it's like a big pillow which goes from the head to the waist, can elevate your head and upper part of the body and reduce snoring. Another device that may help, called Sleep Noodle. You can buy it on Amazon. It's sort of like a belt with extension that can be positioned vertical or horizontal on your back to prevent you from sleeping in that position. Usually sleeping on the back causes most of the snoring. Not necessarily, but in the sleep studies it can be visible. Smoking. Reason number 5 would be smoking and alcohol, that they both contribute to snoring. Smoking irritates membrane of the nose and the throat, causing inflammation and narrowing of the airway, which can lead to snoring. And this can also cause swelling of the uvula and turbinates, but leading to the further narrowing of the airway. Alcohol consumption relaxes the muscles, and that's make it exacerbate the snoring. And I would like to address delicate issues sleeping next to the snoring partners. That can be very frustrating. My recommendation for approaching this situation is to do so with compassion and understanding. Snoring can be a sensitive topic for many reasons. I usually advise expressing concern about partner general health and suggest speaking with a sleep specialist and undergoing sleep study to rule out sleep apnea. On my channel, I conducted several interviews with the sleep specialists, such as Dr. Kanda Panini, and sleep technicians like Rafaela Morales. Some people have even noticed recorded their partners with the app such as a Snore Lab, but to gently bring up the topic of snoring and encourage scheduling appointment with a sleep specialist. As you age, your throat muscles can become weaker and more prone to collapse during the sleep, leading to snoring. However, it's possible to exercise those muscles through myofunctional therapy. This therapy focuses on technique such as nose breathing, maintaining strong lip closure throughout the day and at night, keeping the tongue on the roof of the mouth, and swallowing using only tongue. By strengthening those muscles, you may be able to reduce likelihood and severity of snoring as you age. Please get in touch with Harmony Dental Arts and Harmony Dental Sleep Therapy, and we can arrange your consultation and help you to find root cause of your snoring and solution to resolve it.